In recent months, City News has been reporting on how local paramedic services have been hard hit by staffing and healthcare system strains. The latest situation involving Durham paramedics. Twice this week, the services had to declare a code zero, meaning no one was free to respond to a medical issue.
Obviously, this is very serious because if you're someone who's having a stroke, a heart attack, or another medical emergency, when you call 911, there won't be an ambulance available to come immediately to your house.
Paramedic Union Representative Nico Georgiadis speaking out over what happened on Monday and Tuesday. The dire occurrences, not unique in the region. Search back several months and you'll see similar declarations.
Code zeros have always been occurring. What we're seeing now, though, is the frequency and duration of them has been increasing.
He says the problem is fueled by a lack of staff, as well as delays in transferring patients to doctors and nurses in hospitals, which have been hit hard too.
It kind of works in a perfect storm in which it doesn't allow enough ambulances to be on the road.
Another issue is not enough dedicated resources aimed at treating patients outside of hospitals. There are paramedics who go to homes to help care for those with non-urgent health needs who call 911 for help repeatedly, but permanent provincial funding for what is currently a temporary program hasn't been fully secured.
Due to lack of community supports in the community, people kind of rely on the 911 system to fill in those gaps.
On its own, it will not address the offload delay issue or the other system issues that the healthcare system is facing.
Durham Paramedics Deputy Chief John Riches says hospital delays are the biggest factor impacting his service right now and many others across Ontario. At peak time, there are 32 ambulances for the entire region. At times, he says up to 45% of those crews could be stuck waiting in hospital corridors with patients.
We are deeply concerned when we have reduced ambulances in the community. It is a significant concern and a public safety risk.
With those code zeros this week, he says there were no delays for the highest priority calls, but the lower priority calls, a different story.
That is not something we want to see, and it's not sustainable in the long term. If you're having a heart attack or you're having a stroke or a significant traumatic event, absolutely call 911 and we will respond. Please have faith in that.
We contacted the Ontario Ministry of Health to ask for an update on how they are responding. We didn't hear back by our broadcast deadline. Meanwhile, Georgiadis says his members continue to see negative mental health impacts and are fighting fatigue from heavy workloads.
It's a difficult profession to be in, especially for the past 2-3 years where we've had COVID. It does weigh on you every day you go into work.
For more on this story, head to citynews.ca. In Durham Region, Nick Westoll, City News.